So good afternoon, everybody. This is Sue Grinnell, Public Health Institute. And again, I apologize for the little delay there. My internet sometimes seems to kind of go in and out. But I'm excited today to have Allison Rain. And some of you may know Allison, who was with Academy Health, and now she's with Quantified Ventures. So she's on a new journey. She's the director of health there. And she is dedicated to advancing creative, cross-sector, and collaborative solutions to thorny issues in public and population health, including helping clients explore and execute social impact investment projects, leveraging the pay-for-success model. And also we have Brendan O'Connor, and Brendan actually is in Denver, and he also is with Quantified Ventures. He's an associate director there, where he brings deep healthcare consulting, project management, and advocacy experience, as well as a demonstrated track record of developing and advancing strategic relationships among parties with different priorities, which is a necessity in the area of impact investing. So I'm excited to have both of them here. And what I want to encourage you today is to use the chat box. If you're struck by something, or if you have a question, during this, and I think, I think Allison and Brendan, when would you like questions? Do you want to kind of do it, remind me, do we want to do it at the end, or if there's something like take a break in the middle, in between Brendan and Allison's slides? Which works best for you?
Yeah, why don't we suggest as we go, Brendan and I will just pause and see if there are any questions at sort of critical points, but then we do want to reserve some time at the end for discussion. So
great. Okay, should we get started?
That sounds good.
Okay.
All right, Brendan, you're on.
Allison, I think you're on, Allison.
Oh, I'm on. Okay. All right. No. All right. So, so we wanted to start by sort of orienting the group around some foundational questions. So this concept of what is pay for success financing. So essentially, it's a contracting approach that allows us to bring upfront capital to bear to pay for services and sometimes even capital expenditures with repayment that is tied to achievement of pre-established and measurable outcomes. And I always like to point out that there is sometimes confusion around the terminology, because we also refer to pay for success in the language of social impact bonds. And here, sometimes people assume that it's actually a bond. The confusing part is that sometimes it can be, but it doesn't have to be. So think of the term bond here as more like a contractual bond. So we wanted to spend a little bit of time sort of orienting folks around why this is a thing and why it's a thing now. And so, Sue, go ahead and next slide, please. Thank you. And so, where we start this conversation really is sort of sharing some recent trends that really have precipitated a real interest in this field, and sort of explain why it is such an opportune time to be thinking about using social impact bonds and pay for success. And so really chief among this is really this notion that we are experiencing one of the largest, or the largest, transfer of wealth ever in our country's history. The baby boom generation is aging, and as they age, there's a ton of assets, as you can see from this chart, that are available, and they're being passed down to subsequent generations. And those generations have very different expectations for how they would like to see their dollars used. So historically, it may have been okay to write a check to your favorite charity and have a nice warm fuzzy feeling, but not necessarily understand that it was sort of getting a specific return. And now the expectation is that there's a lot of investors who want to see their money sort of reflect their own personal values. So this is creating a tremendous amount of impact capital that not only wants a financial return, but that also wants a social return. And so here you see a chart in the growth of sort of general impact investing assets, but we estimate, or others have estimated, that there's between 16 and 17 billion dollars specifically around this notion of pay for success or social impact bond market potential. Next slide, please. So, where this leaves us is a situation where we have what we call sort of frustrated capital. So there's all this money sitting on the sidelines that wants to be invested for social good and with some, financial return. But there's a real disconnect between the people who are holding on to these dollars and the opportunities, or dearth of opportunities really, that they see for ready to go deals, like turnkey transactions where they could put this money and see it do the good that they would like to see. So there's a real shortage of investment opportunities, and there's also really not a lot of work or sort of ability to bring together all of the different stakeholders that might need to be involved in helping to shape some of these transactions. So you have this investor community that's off to the sideline, but they don't necessarily know a lot about the social markets where they might want to do good. So in the environmental space or health space or education, nor do they understand all of the research or data that would be behind some of those interventions, nor do they necessarily have the vocabulary or the capacity to truly measure and understand the impact that they want to see. So there's a need currently being filled by the market. Next slide. So we do exactly that, basically. We are sort of the bridging function that brings organizations together from across a range of different sectors and perspectives, and we work to structure these outcomes-based transactions that help to drive capital to the entities that have either proven solutions or sometimes just emerging promising innovations. And we do this work in health, where Brendan and I sit and spend most of our time, but we also have a number of colleagues who work in the environmental space, education, and workforce. All right, next slide. So I mentioned health is one of our areas of focus, and we really view our role as, sort of spanning these different dimensions. So we certainly understand that not only is there a huge trend in the shifting of assets from the baby boom to subsequent generations, but there are a number of other seismic shifts happening in health and healthcare. One of them being this movement toward paying for value over volume. So we view our role as one that can really help to ease this transition to value-based care, partnering with health plans, health systems, and other community-based organizations that are all increasingly focused on outcomes as opposed to necessarily, the sort of historic place we've been, which is a lot of process measurement as a proxy for outcomes. We also view part of our charge as building organizational capacity to sustainably connect funding with outcomes, and we'll talk about a little bit more about that in some of our specific examples. We also focus on high leverage opportunities because we recognize that so many of the things that cause poor health or the root causes of poor population health have to do with things that happen outside of the healthcare system. And so we're looking for opportunities to bring together the different parties who have the capacity to address some of those thorny health and public health challenges. And so just a couple areas where we focused: affordable housing, medical respite for homeless, food insecurity, social isolation, and you can see that these are, historically not things that have necessarily necessarily been the purview of healthcare, but increasingly, as you all know, this is coming to bear on your work. Next slide, please. So this is the model, and I think after this one, maybe we can pause for a couple of questions, because this is really where the rubber hits the road, and people either have this like, I get what the heck it is they're talking about, or no, I still kind of have some questions. So here on this triangle diagram, we sort of mapped out the traditional pay for success model. And you see here 4 actors. So there's the investor community that I referenced earlier. And then there are service providers. So we like to think of these folks as the organizations, sometimes nonprofit, but not necessarily, who have this evidence-based intervention that they would like to scale and enhance. And then we have this outcome funder entity. And the outcome funder's role is to eventually recognize that they derive benefit from whatever the service provider does, but they don't necessarily understand that relationship now, and they don't necessarily understand the strength of that relationship. So our job when we come in as quantified ventures to help structure these outcomes-based financing deals is to develop an economic model that helps to not only sort of convey the relationship between these parties, but also to demonstrate sort of the cost-benefit analysis. So if a service provider provides their service and does their intervention, what benefit does that kick out, and how does that accrue to the outcome funder's bottom line? And so the reason why that's important is because the outcome funder is ultimately the one to pay back the investor whenever the agreed upon outcomes are achieved. And that can happen over a period of 3 years, it can happen over a period of 5 years, it can happen over a period of 10 years. The real crux is that all of these parties have to come together to align around a shared sense of value and to define collectively what that value looks like and what those outcomes are, and then figure out, sort of the time horizon for achievement and all of the mechanics. And that's all part of the process that we go through when we structure these transactions. The fourth critical piece here is the one in the middle, and that's the evaluator role. So, one of the essential dimensions of this model is that we're all focused on achievement of outcomes. So there needs to be an independent entity that can sort of demonstrate or say, yes, these outcomes were achieved, or they were partially achieved, or no, they weren't achieved, or maybe some of the outcomes were achieved and others weren't. So we need to bring along an evaluation design as part of the process, and then also have somebody to actually sort of serve in that function once the deal has been structured and launched and it's going. So I will pause there. I think probably a number of questions or clarifying questions will be addressed as Brendan takes over for the next set of slides. But if there are any quick clarifying questions, happy to pause momentarily here.
Mm-hmm. Yes, any questions for the group? And some of you I know don't always have audio, so if you want to put it into the chat box, that's okay too.
Where does the money come from to repay the investors?
So that comes from the outcome funder. So the outcome funder is the organization that agrees to pay back those investors plus whatever the agreed upon rate of return is, should the outcomes be achieved.
Where does the outcome funder get the money to repay the investors?
Yeah, also a good question. So, the theory is that the outcome funder derives some economic benefit from whatever the service provider does. So sometimes that's savings. And so they look at the bottom line impact of whatever the intervention was. And we don't proceed with one of these things unless the return on investment is such that the outcome funder would financially be better if the intervention were to proceed. Does that make sense?
Yes, thanks.
Sure. All right.
Okay.
Take it away now, Brendan.
All right. And I'm sure there's going to be a lot more questions about that slide. Feel free to chime in at any point. But just to recap that, there's a few significant benefits that we associate with Pay for Success as a financial tool as compared to philanthropy or other sources of capital to grow or to scale these types of projects. The first is access to impact capital. So private investors who are interested in project outcomes provide the upfront capital and are willing to take on downside financial risk. So this is really important for organizations or collaboratives or projects where they are trying to enter into a different type of agreement or contract with a new partner to get off the requirements of philanthropy or to tap into a new source of funding. Right? A lot of organizations with whom we work are solving problems or focusing on issues that are growing. For instance, a lot of our work related to aging, we have a growing demographic of those 65 and plus, yet the funding through traditional government or philanthropic dollars is not growing. So we need to identify some new innovative ways to tap into new sources of capital to tackle growing issues. So for projects in which, maybe for the first time are trying to partner with government or health systems or employers or health plans, where that is a new type of relationship, the ability to shift some of the financial risk to impact investors who are willing to take that risk on can allow organizations to maximize their likelihood of entering into partnerships with these organizations. Oftentimes, the barrier to partnering is capital. So for instances, when that is a significant barrier, being able to shift that risk to another party who's more than happy to take that risk on can be really valuable. The second benefit that we think about is sustainable funding. So while these are termed projects, meaning there is a start date and there is an end date, typically in the range of 3 to 7 years, we see these Pay for Success projects last. We're confident that the model can force a conversation around return on investment and value that the project drives to the outcome funder. And at the end of the project, or sometimes during the project, the value becomes so clear and the ROI is so clear that it would be unwise for the outcome funder to not continue procuring those services directly. So our hope is that this is a pilot project, if you think about it that way, that can demonstrate with very rigorous evidence that the value and the ROI is there and is associated with this intervention, so that after the project, the investors go home, Quantified Ventures goes home, the evaluators go home, and now we're talking about a direct contractual relationship between the outcome funder and the service providers. The whole point of this is to get to that point. So it's a very valuable model to shift some of that cost burden from the outcomes funder while we demonstrate the value in a really rigorous way that makes them comfortable to paying for those services on an ongoing basis, helping to reduce reliance upon philanthropic dollars. By no means are we saying that this should totally replace philanthropic dollars, but it could be an additional tool to help grow or to scale that philanthropy can't support. The third thing we think about is the linkage to outcomes. So it's what everyone's talking about in this world: outcomes over outputs, value over volume. A lot of buzzwords around it, but this is one of the very few models out there that inherently incentivizes each of the parties in the transaction to care about the outcomes, because ultimately investors don't get their money back unless the outcomes are achieved. The service provider absolutely wants to achieve better outcomes because it's better for the individuals they serve, and their reputation is on the line. They want to show that they're an incredibly effective organization. And for the outcomes funders, they clearly care about outcomes because it's better for the population that they manage or serve, and theoretically drives down costs while improving the quality of care. So it's a model in which by way of tapping into impact capital. And the only way that capital is returned to investors is upon the rigorous evaluation and validation that the outcomes have been achieved. We're now in a world where everybody is signing up to achieve certain tangible outcomes that can be achieved and will improve the value of care for a population. So it's a very elegant model to align incentives between oftentimes very different parties. The fourth benefit we think of is improved data collection. So the pay for success model kind of inherently focuses on evaluation. The independent evaluator is a key party here. So I'm getting a little bit of a pop-up here in my window. I'm not sure if others are seeing that. If they are, hopefully that will go away. If not, I'll keep going. But the evaluation process supports production of valuable data on the cost effectiveness and scalability of the program. Oftentimes we'll bring in an independent validator or evaluator to support the measurement of success for the project, which requires the collection of data, the reporting of data, and the analysis of it on both the cost effectiveness and ROI, but other outcomes as well, showing if scaled, what type of value would this program drive, which helps with the future planning and reporting. And lastly, we think about stakeholder engagement support. So the Pay for Success model promotes stakeholder engagement across multiple entities, investors, outcomes funders, whether those are governments, health systems, health plans, evaluators, and social service providers and community-based organizations. And it's an opportunity to bring everybody to the table, funded by impact investors, which reduces a huge barrier, to get everybody aligned around the same outcomes, focused on the same mission for this project. So like a lot of the work that you all are currently doing, it's a really good model that promotes multi-stakeholder, cross-sector engagement, which is a big reason why we're a fan of the model. Next slide, please, Sue. So the slide after this, and we can skip forward once again, is thinking now about how to assess whether this could be the type of model that supports your organization's abilities to scale and to do more of what you do every day through this model. Some of the key things that we ask, and we're clearly not going to determine today on this webinar whether this is the model, the silver bullet for all of your organizations. We recognize that it may not be. There's a number of things that we look for in organizations and projects that may make this a viable tool or may not. In either way, that is okay. We recognize this isn't a silver bullet. There are multiple forms of funding that can help an organization scale. This is but one. So some of the things that we look for to determine whether an organization or a project is a strong candidate for this type of model is whether there is a promising or evidence-based intervention that requires growth capital to improve or scale. So by way of the design of the Pay for Success model, in that outcomes must be achieved for the cash flow to work, we do need to see that there is some existing evidence that undergirds the effectiveness of the transaction and the intervention. That's ultimately how the investors are going to diligence the transaction and determine whether the risk is worth it for them. So right up front in our projects, we evaluate the existing evidence base and determine whether, if scaled, fidelity to the model, that the evidence could be replicated and we can drive outcomes associated with the intervention. Another really important thing is precedent around relationships or work with the outcome funder. They're the hardest party to get to the table, as I'm sure all of you know through your work. Getting a government or a health system or a health plan, very bureaucratic organizations, to the table thinking differently about how to partner can be complicated. And it's no different in these projects. We think there are some really key pieces to the model that can help reduce some of the barriers that we often see, but nonetheless, we need to get them to the table committed to the project. The degree to which your organizations have already started those conversations, already started building those relationships with the outcomes funders, that value the outcomes that you're capable of demonstrating can really help move these projects along quickly, and maximize the likelihood of a project coming together. That said, we work with organizations all the time who perhaps haven't started those conversations yet, recognize the value that they drive to a different type of organization, but haven't started those conversations yet. And that's totally fine. And lastly, do the outcome funder and the service provider have a shared understanding of the value, right? So the way that you think about value and the outcomes associated with your intervention, to whom do those outcomes accrue? Do they value those outcomes? Do they think about it from a purely monetizable standpoint? Or is there other value there from a PR standpoint or from a political standpoint, that if you helped them achieve certain outcomes, they would value it? So having those conversations about shared value, a mutual understanding, can really be helpful to move these projects along. Next slide, please, Sue. So we're just going to give you a couple of examples here. Let's make this real, right? We've talked about it from a conceptual standpoint, what this model ultimately looks like, some of the benefits associated with it. Now let's talk about a couple of our clients and a couple of the projects that we're currently working on that could give you a good sense of maybe how some case studies and examples may tie to your work or not. Next slide, Sue. Meals on Wheels America. So one of our longest standing clients, a really interesting organization in that they're a 501c4 that operates at a national level, representing the interests of thousands of Meals on Wheels organizations around the country. Some governmental, some nonprofit, some that really take care to provide fidelity to the Meals on Wheels models, others that are a little more autonomous. They're charged with representing the interests of thousands of these organizations who are struggling with the change in demographics. 10,000 Americans turning 65 every day, more and more wanting to age in place with dignity in their homes, in affordable housing and affordable living communities. At the same time, funding from the Older Americans Act and a lot of other traditional funding sources has been stagnant at best and declining oftentimes. So Meals on Wheels America is helping their members think through how to tap into alternative forms of capital to help them scale, help them survive, and help them stay relevant in the years to come. So we've partnered with Meals on Wheels America a couple of years ago to help them think through whether this pay for success model could be a tool that can help their members partner with health systems, partner with health plans to be the eyes and ears in the homes for these doctors and for these plans in a way that they haven't to date. So through their More Than a Meal model, which focuses not just on providing meals, but the social determinants of health around social isolation, safety, feeling comfortable aging in their home and confident. All of these different things that the Meals on Wheels volunteers or case managers can help health plans with should be funded, perhaps outside of philanthropy. There's a real strong case that they could make that they drive value, not only to the members or to the patients of the hospital or health plans, but to the plans themselves in a real way with economic value associated with it. So with Meals on Wheels America, we conducted a feasibility assessment, determined, yes, this could be, in fact, a tool that helps them scale. We focused on risk-bearing health systems, Medicare Advantage plans, dual special needs plans. And with them, we're now on our third project. So we are structuring a project in Baltimore, Maryland, with a large hospital system, helping to kind of build that link between the hospital and the Meals on Wheels volunteers and case managers to provide better post-discharge care to the hospital's patients, with the goal of reducing ED visits through falls, with the goal of reducing hospitalizations and hospital readmissions. By providing them twice daily meals, supports and conversations and social isolation reduction strategies. All of these different components of the Meals on Wheels intervention drive value to these health systems and health plans. Since that first project, we've now scaled this. And we're focusing on project number 2 in Tampa and Louisville, Kentucky, with a large Medicare Advantage plan. Now we're focused on project number 3 and getting that project underway in New Jersey, focused on perhaps accountable care organizations or managed long-term services and supports plans. All to say, a lot of different outcomes funders that benefit from the Meals on Wheels intervention, we're proving that out through the Pay for Success model in several use cases. So hopefully, once our project with the hospital is done, and once our project with the Medicare Advantage plan is done, we've helped Meals on Wheels build a stronger evidence base that they can then use in future negotiations and conversations with health plans and health systems nationwide. All of this is great. What we're doing with Meals on Wheels as well is helping them build that in-house internal capacity to do this on their own. So they're working with Quantified Ventures on their first 3 to 5 projects, but we're helping them to do these Pay for Success transactions on their own as a revenue generating value add service that they can provide to their members long term. So we're having a lot of fun with this project. And I think you can tell from this type of intervention how it would fit really well into the Pay for Success model. And I'll give one more example on the next slide. This is a project with the Latin American Youth Center focused in Washington, D.C. They work with disconnected Latino and African American youth ages 16 to 24 through a mentorship program called Promotor Pathway. Promotor Pathways has been around for quite a while, largely philanthropically funded, but they developed a randomized control trial a few years back that showed incredible outcomes that accrued to quite a few different types of organizations at the government level. So we're helping them scale their Promotor Pathway program within Washington, D.C., focused on building that relationship with the D.C. government so that the government recognizes the value related to teen pregnancy reduction, healthy births, school truancy, and reduction in homelessness or the likelihood to become chronically homeless, all of which are outcomes that the randomized control trial that they conducted showed that they do in fact have an impact on these outcomes. There's value there that's not being captured, that the government is not inherently valuing by contracting directly with LAYC. So through this Pay for Success project, we're developing a pilot project which will build that relationship and pay the Latin American Youth Center once those outcomes are achieved. So with that, just a couple of examples, quite a few more examples of projects that we're working on, but thought these would be a couple of examples based on the work that you all do that may resonate. But with that, I'm going to turn it back over to Allison, and she's going to talk to you about when Pay for Success may not make sense. And there are some other models that we're exploring in cases where Pay for Success may not be the right tool for your organization. Hey, Allison, I think you're on mute.
Are you?
There we go. Thank you. So we did want to acknowledge that while it is a really elegant model that helps to address a lot of the challenges that many of you and that historically many of us have experienced firsthand, you know, there are some limitations to this traditional Pay for Success financing approach, and so we wanted to acknowledge those partially as a way to segue to this other model that that Brendan mentioned. So, you know, one of the challenges is that this is a sort of one and done transaction. So it's possible, even if the return on investment, you know, is positive and the outcomes are achieved, that an outcome funder might not elect to continue working with the service provider for a variety of reasons, some of which you could, you know, guess at and anticipate, others that you might not envision. And, you know, because of this, we sort of acknowledge that as a potential longer term risk. We also, have identified the historic reliance on expensive and fairly inflexible evaluation models as being somewhat problematic. And in fact, when the pay for success model, was imported initially to the United States, there were some big pay for success initiatives that were launched and sort of got caught in the crosshairs of the sort of gold standard of randomized control trial, in part because when you have such a sort of rigorous and well-designed evaluation mechanism, if you learn within the first year that the intervention you are running isn't necessarily generating the value or the outcomes that you had hoped, even if you know how to change your model or have ideas for how to change your model to adapt and address some of those challenges that might be experienced on the ground, the RCT doesn't allow you the flexibility to do that, because then you compromise your design. So there are some tensions here between sort of rigor and wanting to really have a solid evidence base demonstrating the evidence after a pay for success transaction, while also appreciating that these things can be messy in their application on the ground. The third is that, it really relies on the outcome funder being at the table early. And we have learned this lesson in a lot of different instances. And it's why sort of we make a concerted effort at the front end of any pay for success transaction to work as quickly as we can to bring those two essential parties together. So sometimes our work starts with the service provider, sometimes it actually starts with the outcome funder, but regardless of where it starts, we always feel the need to bring those stakeholders together early on, because that's really critical to identifying that shared set of values and outcomes. And then the other fourth point is that it's typically limited to a singular intervention. So while there might be multiple outcomes that are measured or assessed as part of the transaction, it is typically one organization or one intervention, and not sort of a suite of interventions that are being brought to bear on a larger population model. And so, we recognize that that has some limitations. So, next slide, please. We have been doing some work to think about alternative models that could be used to help address some of these limitations, but nonetheless bring impact capital to help support initiatives, perhaps community-based, perhaps otherwise, to really get the capital they need. And so here you'll see, in more of a rectangular shaped diagram as opposed to the traditional triangle, there's still some of the same actors, and they still very much play some of the same roles. But there's also a new actor in the mix, and so I'll sort of start by talking about that, and then say a little bit more about how the model actually works and the relationships. So the new actor here is this notion of an outcome fund manager. And this doesn't have to be like an individual. In fact, it could be a group, an advisory board, or some type of body that really helps to manage the fund and make decisions for how those resources are deployed. And so that's a really critical distinction. There's sort of an intermediary between the service provider and the investor that is, helping to quarterback how these resources are deployed in a community or other context. It also allows for multiple different types of service providers. So these sort of like shovel-ready looking folks are meant to represent the different types of organizations that might be part of a suite of services or interventions. And then there's also, the sort of outcomes that are achieved. So the notion is you may not know going in to this type of activity what contributions a particular organization brings and how that affects the outcomes that are desired. And that might be part of the learning process in this fund model, which makes it really critical for that manager to have the flexibility to be able to titrate and sort of direct resources accordingly as you learn this. Because of that flexibility imparted by the model, we refer to organization or entity that's number 4 here as a validator as opposed to an evaluator, because here the role is still rigorous, but really just sort of validating that a particular outcome or a set of outcomes has been achieved in a way that allows for that flexibility. And this definitely would not be sort of a randomized controlled trial type of environment. There's just too many things happening at once in this kind of fluid environment for that to be feasible. So just a little bit more sort of context on the Outcomes Fund. So, it is defined, as I mentioned, by the fund manager and, maybe an investment committee and a network of partners or collaborators. The outcomes funders can again be multiple different types of organizations, very similar to the last model that we shared. And the value of the outcomes, and they value those outcomes and commit to paying for the outcomes once achieved. So again, it's a similar, sort of outcomes-based financing model. And the fund manager works with the investment committee to deploy capital into those strategically defined best-in-class interventions represented by the shovel-ready guys. That validator measures the outcomes. The capital that comes in is typically, we think of this as being a higher level of investment than what we see in a typical sort of pay for success model. So just to put a frame on it, there's probably a lower level bound at which sort of a pay for success project doesn't make sense simply because the transaction cost would be too high. So I think like 3 million is sort of the lower bounds of a reasonable pay for success level. But we've seen them go, we did one that was 25 million, and we think there's possibility to go, well beyond that. But just to put a number here, we're thinking that a fund level might be somewhere in the ballpark of, $100 million. So that takes, a little bit more perhaps to raise, but it allows for a lot more to happen on the ground. And then we basically price the outcomes at a level that's higher than what they cost to achieve. So we envision this fund as being something that replenishes. And so it also helps to address the challenge of not having a sustainable source of financing necessarily or absolutely beyond the period of the pay for success transaction. So there's certainly maybe some questions about that, and let me just talk through a couple of the benefits, and then I can pause and take any questions on the outcome fund model. So on the next slide, we've sort of enumerated the benefits that we see to the model. One is that it increases the investment capacity for a suite of underfunded and highly complementary and effective solutions, and it really acknowledges the fact that there's usually more than one social determinant or other factor that's contributing to poor health in our particular case. It also engages more impact investors who can invest in outcomes that align with their values. So typically, when we do a pay for success transaction, you have to find an impact investor who cares about that outcome. Here, you have probably more different types of outcomes that might speak to a broader set of potential investors. So you potentially have a larger pool of resources to access. As I mentioned, it also comes with a more flexible sort of validation and evaluation design that anticipates intervention adjustments over the course of the time frame, and it anticipates asset allocations being changed in a way that optimizes for outcome achievement. It's also an opportunity for the outcome fund to replenish. So creating that sustainable funding that we hope is part of the traditional pay for success model, but isn't necessarily guaranteed. And then we also see this as a mechanism to help aggregate capital faster and deploy it more efficiently across multiple interventions. And that really is a function of having that role of the manager working collaboratively with other stakeholders to sort of identify what's the best way to deploy these resources in order to maximize our collective impact. All right, so let me pause there and see if there are any clarifying questions before we move ahead.
And please feel free to use the chat box as well. Any questions from the group?
All right. Well, folks can think of them while we move forward. We wanted, similar to the last slide or the last sort of this type of slide where we pose the question, are you ready for, a pay for success transaction or an outcome fund? We just wanted to offer up some key considerations. So that's what's on the next slide here. It really just sort of allows you all to go back to your colleagues and do a little bit of a self-assessment. And so in the interest of time, I won't sort of go too deeply into this slide, but we wanted to sort of share it as a little bit of an exercise for you all to do with your team, perhaps if that's of interest after this conversation. So actually, in the interest of time, and so that we can have a little discussion at the end, let's just go ahead and move to the last couple slides we have. So that next slide. So we, just wanted to recap sort of our beliefs to sort of put all of this in context for you. So one of the things I didn't articulate at the outset is that, Quantified Ventures is a for-profit organization, and we're one of the few for-profit entities that's sort of working in this space. And we are very intentional about having that be our model, because when the Pay for Success model was first imported from the UK to the United States, it was financed primarily through government and philanthropy, and those resources were dedicated to a few nonprofit intermediary organizations who were tasked with essentially serving in this role of identifying the different stakeholders and trying to work toward development of fully structured and transacted deals. And we've seen several years later that while there's been a lot of lessons learned and there's some really beautifully designed transactions, there's actually very few transactions relative to the level of investment that was dedicated to this field. And our mission is really to help accelerate access to impact capital, which means that we are very, very focused on bringing down the transaction time and cost. So we want to see these happen much more quickly than historically has been the case. And we also want to see them done more cheaply than has historically been the case. And the third, thing I would say about that is that a lot of the, the handful of deals or transactions that have made it all the way through the pipeline in this sort of prolonged process are very often so customized and so highly tailored to the particulars of that deal that they don't necessarily resonate with the investors and they don't necessarily look like a new asset class or a financial product that anybody in the financial sector would easily be able to identify and recognize and replicate. So we believe very strongly in bringing this sort of pants on fire mentality to galvanizing this work, blending the strength of social and private and public sectors to really accelerate access. We really want to see a marketplace emerge for outcomes-based transactions that can help to address some of our really thorny problems, not only in healthcare, but also in environment and education. And we believe that this new source of capital isn't going away, and it's really frustrating for all of us to see all of that capital sitting on the sidelines. So we're working as hard as we can to sort of bring it to bear on all of the great interventions and programs that we know exist across the country, but that historically haven't had an opportunity to benefit from those types of resources. So next slide. And this is, really just to provide a little bit more example of the types of organizations with whom we've worked historically. And it represents both, environment, education, and health and healthcare. And then we did provide a couple other slides, like sort of example project slides, but folks can sort of peruse that perhaps at your leisure. And maybe we can use the last, sort of 5 minutes or so to answer any other questions or go back to any of the slides that we may have shared if there's something that you wanted to spend a little bit more time on.
Great. Thank you, Allison and Brendan. So I had actually a question in the chat box, and one was, are the initial funding source and the outcome funders, they're different groups, or are they the same? And I think, so the funding source.
So the investor is a different source. Think of, there's a range of different types of investors who are looking in the social impact space, but it can be Bank of America, it can be Goldman Sachs, it can be Calvert Impact Capital. There are a lot of different types, but they collectively represent a lot of dollars that they are managing on behalf of these subsequent generations who really want to see their money do good. They want to see it generate a return, but they also want to see it do good. Mm-hmm. And then the outcome funder is a different entity. It can be a range of organization types, as we've described, sometimes government, sometimes health plans, sometimes risk-bearing health systems or ACOs. In health and healthcare, there's a lot of different flavors as well. Mm-hmm. Mm-hmm. Does that help clarify?
I think so. One question that I was wondering about on the second example for the outcome fund, just in terms of going back to them. So it seems like all of those funders would need to agree. Otherwise, I guess I was just thinking of complexity theory, like how do you decide who gets what from what they invested? And I don't know if that makes sense, but if you could kind of speak to the return in that model as compared to the other, where it's just a one-on-one.
Right. So I think the notion is that they don't have to agree necessarily, like all of the investors don't necessarily have to prioritize all of the different outcomes. Okay. They would be investing for the outcomes they care about. So that, you can have, it's why it's actually a broadening lens, so that you can bring in more investors, each of which might, care about a subset of the things that are happening in a community. Mm-hmm. Does that help?
Yeah, no, that's good. That's okay. Helpful. So I know we just have a couple more minutes. This is a lot. This is why we're recording it, and maybe you'll listen to it again and again. Hopefully. So any questions from the group? Anything that strikes you about this or not clear at all? Anne, I see Anne is on, Anne Haddix. I'm going to call her out. I'm wondering if you're still on, if you have any comments or thoughts or that's from listening to this.
No, not right off the top of my head. I mean, I've been aware of this type of investment for a while, and it works for some areas. It doesn't work as well for upstream prevention as it does for more of the social determinant related issues related to acute chronic care. So, but it's a really useful tool.
Mm-hmm. Great. Thanks, Anne. Okay.
I will just say that you know, when I first heard about the model, I was very much in the mindset of, you know, the service provider, right? Because I was working with a lot of folks at the community level who had these, you know, great visions for what they wanted to do and what they could achieve. And they just, you know, the issue was they were perpetually on this hamster wheel of writing generally fairly small grants in order to achieve pretty large objectives to tackle really large problems. And I think partially what I so appreciate is that this model affords an opportunity to actually ask the question, what is it that I need to optimize for what I want to do and what my organization or a set of organizations is capable of doing relative to, you know, what can I pack into this very narrow RFP opportunity. So I just wanted to sort of offer that up because I feel like it's a little bit of a mind shift and hopefully if people sort of go through that exercise, then you can start to sort of view this as a potential mechanism for at least having some of those conversations.
Mm-hmm. Great. Okay. Well, thank you so much, Allison and Brendan. This was great. This is a lot.
I know.
But it's good.
Brendan and I are available, you know, by 27.
Great. Great. Okay. Thank you, everybody.
Thank you, Sue.
Thanks.
Thank you, everybody.